Hey there, I'm Dr. Carson. First off, welcome to the clinic. We're really glad to have you here as a new patient, and I hope you like our new facility here. Second, I'm going to take a few minutes to talk with you about some housekeeping type things and some expectations before I come into the room to see you. Right now, I'm in my office reviewing your new patient paperwork to get an idea of what things we'll be focusing on today. My job as your family doctor is to know what's going on with all your medical conditions. I'm like the quarterback who directs all your care, and I'm the link between you and any specialists you'll need to see. Instead of focusing on just one problem like a specialist does, I have to know everything that's going on about you. If one of your medical problems is not being managed correctly, I have to step in and straighten things out. That's why this first meeting is so critical and why we make this meeting 40 minutes long. Now, fairly often, people will come to see me as a new patient for the first time, and they have several chronic conditions that aren't being managed correctly, their medications are all messed up, and they have several new issues that they want to deal with today too. This is where we have to be selective about what we're going to talk about. If you have 7 or 8 chronic medical conditions like diabetes, high blood pressure, chronic low back pain, this might be a part 1 of part 2 type visit, but I promise we will address all your issues thoroughly and make sure you're on the right track on everything. Sometimes it makes sense to get your labs done and then come back in a few weeks, and we can go over your labs face to face and then mop up the rest of your problems. So today, in addition to getting to know you, we'll do a full physical and we'll spend some time at the end talking about health maintenance topics like immunizations and screening tests that are based on your age. Let's take a second to talk about lab work. I like to get new patient blood work on everybody. We check for things like liver function, kidney function, cholesterol, and we'll screen you for anything else that might apply to your symptoms that you're having today. These are fasting labs, meaning nothing to eat or drink after midnight. So unless you're fasting right now, we'll have to get these labs done at another day. Your blood work will be done here at our clinic. When your visit is done today, you'll check out at the front desk, and they will schedule a time when you can come back and have your new patient labs drawn. Whatever day and time works with you is fine with me. I want to mention something on the front end. There are some medications that I don't prescribe, and sometimes for people this can be a deal breaker. So I want to mention this now so that everyone is clear about where I stand on this. The front desk should have given you a big list of medicines that I don't prescribe, but I just want to make sure that we're all very clear on that list and that there are no exceptions here. One more thing I want to mention to you is how we communicate lab and imaging results. We use a service called MyChart, and this is a service that allows us to communicate with you over email. When you get your labs done or any imaging, we'll send the results to your email directly. Along with the results, I'll have dictated a message basically explaining what's going on and what the next step will be. We found that this system is a lot better than trying to call people and explain things over the phone, because about half the time we can't get in touch with you, and there's an endless amount of phone tag that goes on between the patients and our nurses. So how does this work? Well, on those forms that you just filled out, there was a spot that was for your email address. Our front desk person right now is in the process of sending you an email that's a link that shows you how to activate your MyChart account with us. So if you have your phone with you, go ahead and check your email now and see if you have that email in your in-basket. Please understand, we assume that you're checking your email and that you are getting our results that we send to you, and there's not going to be any phone calls. This is a good time to talk about refills. There are 2 different ways that you can do a refill request for your medications. One is through MyChart that we just talked about. There's a button that allows you to request refills through that. The other way would be to simply call your pharmacy and ask them to send us a message to refill your medication. What we don't want you to do is to call our front desk person and ask for a refill. I feel like that was a lot, and you haven't even seen me yet. So thanks for hanging in there on all that. And just wanted to say again, I'm really grateful to have you as a new patient, and I'll be in here shortly.